Why don't we have universal health care in America today? I've got a simple answer for that. We don't have universal health care in America today because of insurance companies, drug companies, and their lobbyists in Washington, D.C. That's why we don't have universal health care. In 1993, the Democrats controlled the Congress and the White House, and we actually had a president who had the courage to propose universal health care. But that plan was killed. It was killed and run out of town by an army of lobbyists who were working for insurance companies, drug companies, and HMOs. Since 1993, the number of people who don't have health insurance in America has grown from just over 39 million to 47 million. And insurance premiums have nearly doubled. And the cost, and by the way, we didn't get universal health care, but we got NAFTA. We need universal health care. We didn't need NAFTA. But the cost of that failure 14 years ago is not just somebody's political fortune or their scars. It's the millions of Americans who've now gone almost 15 years without health care, and the millions more who are being crushed by the cost of health care. I'm glad that the architect of the 1993 effort to pass universal health care is coming out with a proposal today. As I mentioned earlier, I came out with a proposal 7 months ago. And if imitation is the sincerest form of flattery, well, I'm flattered. I want to say, though, that unless Senator Clinton is willing to acknowledge the truth about our broken government and the cost of health care reform, I'm afraid this flattery is not going to get us anywhere. Actually bringing change starts with telling the truth. And the truth is that this system in Washington has been hijacked. It's been hijacked for the benefit of corporate profits and the wealthiest people in America. Many good people go to Washington and stay so long that they actually think that they can work within this system. And they can work within this system that destroyed health care reform to bring about health care reform. Here's what I believe. I don't believe you can sit down with lobbyists, take their money, and cut a deal. If you defend a system that defeated health care, I don't think you can be the president who brings health care. The only way to bring real health care reform is to end the Washington influence game and to end it once and for all. You also have to be honest about what health care costs. You know, I have a health care proposal. It's not free. I don't claim that it's free. And in fact, my plan costs $90 to $120 billion a year. But I have a way to pay for it, which is to get rid of George Bush's tax cuts for people who make over $200,000 a year. The lesson that Senator Clinton seems to have learned from her experience with health care is if you can't beat them, join them. I've learned a very different lesson from decades of fighting these powerful interests, which is you can never join them. You just have to beat them. And if you're gonna negotiate universal health care with the same powerful interests that defeated and killed it before, your proposal isn't a plan. It's a starting point. I'd like to know what principled compromise looks like on universal health care. When you cut the deal on universal, who's going to be left out? And if you don't compromise on the universal part, does that mean you compromise on the health care part? Lower quality, higher costs? I don't believe it. In the America I believe in, we don't compromise on principles. I will not compromise on universal health care, not on coverage, not on quality, not on cost. I'll fight for it with everything I've got. And I'll tell you something else I will do as president. On the first day that I am sworn in as President of the United States, I will submit legislation to the Congress that ends, stay with me on this, that ends health care coverage for the President, all members of Congress, and all political appointees in both branches of government on July 20th, 2009, unless they have passed universal health care for the United States of America. There is no excuse for the President and for the Cabinet and for members of Congress to have health care when America doesn't have health care.